Have you noticed changes in your size or firmness during intimacy and quietly wondered if there's anything you can do about it? I'm Dr. Thomas, here to help men over 60 understand what's really going on inside their bodies and how science-backed training can restore strength, control, and confidence in just a few minutes a day. What I'm about to share isn't a gimmick, a pill, or a surgery. It's an approach that uses your own body's hidden muscles to naturally boost firmness, stability, and even the way your size appears, no matter your age. For many men, aging comes with a quiet list of frustrations, erections that don't feel as strong, a downward angle that wasn't there before, or a look that seems smaller. It's easy to blame hormones or think it's just aging, but in reality, there's a powerful mechanical part of your body that most men never train, even though it's essential for sexual performance. Today we're going to explore those hidden muscles, understand how they work, and walk step by step through a 3-minute daily routine that can transform your function and confidence. Inside your pelvis lies a network of deep, supportive muscles known as the pelvic floor. Among them, two play a starring role in erection quality, the bulbocavernosus and the ischiocavernosus. These muscles have one job during arousal: to trap blood inside the erectile chambers and keep it there under pressure. The bulbocavernosus squeezes the base of the penis, compressing veins so blood can't escape. The ischiocavernosus reinforces that pressure, holding the shaft up and maintaining the upward angle men associate with youthful erections. When these muscles weaken through years of sitting, reduced activity, surgery, or simply disuse, blood escapes more quickly. The result? Erections feel softer, fade faster, and lose that stable, lifted angle. This isn't just theory. A 2005 randomized controlled trial published in BJU International followed men with mild to moderate erectile dysfunction after 6 months of targeted pelvic floor training. Over 40% regained normal erectile function without changing medication, and another 35% saw significant improvement in firmness, control, and satisfaction. The reason is simple. Strong pelvic muscles improve something called venous occlusion, the internal valve system that holds blood in the penis. With better closure, you get more pressure, more stability, and longer-lasting function. After 60, several factors accelerate pelvic muscle decline. Long periods of sitting can literally switch these muscles off. Surgeries like prostate removal can disrupt nerve signals. Natural age-related changes in coordination mean even if the muscles are there, they may not activate at the right moment. The consequences aren't limited to firmness. Men often notice a flatter angle, reduced responsiveness, and even a shrinking look. This visual change is often misunderstood. The tissue length hasn't changed, but the loss of internal pressure makes it appear smaller. The good news? You can retrain these muscles at any age, without gym equipment, without drugs, and see improvements in weeks. Let's be clear, pelvic floor training does not increase anatomical length, but by boosting blood flow pressure, it fills the erectile chambers more completely, creating a firmer, fuller appearance. There's also a neurological benefit. When you contract these muscles correctly, you send stronger sensory signals to the brain. Men often report feeling more connected, more in control of rhythm, and more pleasure during intimacy. It's not just about performance. It's about restoring a sense of ownership over your body. Before you can train these muscles, you need to find them. The simplest way is during urination. Try gently stopping the flow midstream. The muscles you use to do that without tightening your legs, abdomen, or holding your breath are part of your pelvic floor. Do this only once as a test. Regularly stopping your urine can cause bladder problems. Once you've identified the sensation, you'll practice it away from the bathroom. Here's your foundation routine. Find a comfortable position, sitting or lying down. Take a few natural breaths to relax. Gently contract those pelvic floor muscles as if lifting something inside. Hold the contraction for 3 to 5 seconds. Release completely for another 5 seconds. That release is just as important as the squeeze. Repeat this cycle 10 times. Aim for 2 to 3 sets per day. You don't have to do them all at once. Spread them through your morning, afternoon, and evening. While practicing, watch for common mistakes. Don't squeeze your thighs, buttocks, or abdomen. Don't hold your breath. Keep breathing normally. Don't push down. The movement should be a gentle lift. Most men find they can work this into their daily routine without stress or discomfort. Even a few rounds while watching TV or reading can make a difference. Remember, this isn't about brute force. You're training for control, coordination, and endurance, and the first improvements often come quietly. You might notice better muscle awareness, easier activation, or more stamina before you see visible changes once you can isolate the muscles. The next step is neuromuscular control, teaching your brain to recruit them instantly when needed. Some men use biofeedback tools or guided apps to get real-time information on muscle activation. This can speed up progress, especially if you learn best by seeing or feeling direct feedback. Even without devices, you can practice quick rhythmic contractions to mimic what happens during arousal. Short squeezes, followed by complete release, train the muscles to respond rapidly, keeping you in control when it matters most. Here's what most men experience with consistent practice. Weeks 1 to 2, stronger awareness of the muscles, even if contractions are weak. Weeks 3 to 5, improved hold times, less effort to engage. Week 6 to 8, noticeable improvements in erection, angle, and stability, more control during intimacy. Weeks 10 to 12, fuller appearance, greater firmness, and for many, renewed confidence, especially if blood flow was a limiting factor before pelvic floor training offers more than sexual benefits. It can improve bladder control, support prostate stability, and reduce the risk of pelvic organ prolapse. It's low risk, has no drug interactions, and can be done anywhere for men wanting to avoid dependence on medication or who experience side effects. This is a safe, effective starting point. Let me share a story. Mr. T68 came to me frustrated. He relied on pills before every intimate moment and worried about side effects. We built a simple 3-minute routine into his mornings. 10 weeks later, he told me, for the first time in years, I felt in control. No pill, no planning, just me confident again. That transformation wasn't magic, it was muscle hidden, muscles he'd never trained before. Like any exercise, more is not always better. Overtraining can cause tension or discomfort if you experience pain, urinary changes, or anything unusual. See a healthcare provider for most men over 60. This is a safe doctor-approved practice, but it's always wise to get clearance from your own physician before starting if what you've heard so far is giving you hope. Give this video a like. It's a small gesture that helps more men discover practical, science-based solutions like this, without shame, without guesswork. Once the basic contractions feel natural, you can add progressions to challenge the muscles further. Long holds. Gradually build from 5 seconds up to 10 seconds while maintaining full control. Quick pulses. Practice rapid contractions for 1 to 2 seconds. Then release. This builds reflexive strength for real-life moments, functional practice. Engage the muscles during activities like climbing stairs, lifting light weights, or standing from a chair. So they activate automatically in daily life. These small upgrades help bridge the gap between exercise and performance, making the improvements feel second nature. And here's a bonus benefit. Men who keep their pelvic floor strong often notice better posture, less lower back strain, and more energy overall, because these muscles are part of your body's core support system. Think beyond the next few months. Pelvic floor health supports better urinary control even decades from now, protection against post-surgical complications if you ever need prostate treatment, confidence in physical intimacy without the constant worry of losing firmness mid-moment. You're not just training for, now you're investing in quality of life for years ahead. Performance issues can create a quiet cycle of anxiety. The more you worry, the harder it becomes to perform, and the more the muscles lose. Coordination. Training breaks that cycle when you feel the difference in firmness, angle, and control. The mental weight lifts, and that confidence changes everything in the bedroom and beyond. Another patient, James 72, told me he'd stopped initiating intimacy because he didn't trust his body anymore. 3 months into consistent training, he not only regained reliable firmness, but he also said his relationship felt alive again. It isn't just his body that changed. It was how he saw himself. Let's recap. Stronger pelvic muscles keep blood where it's needed for longer, producing firmer, more stable erections. Better neuromuscular control means you can engage these muscles at the right moment without thinking. Fuller appearance and improved sensation restore both physical and mental confidence. Side benefits include bladder control, prostate support, and reduced injury risk. Every year you leave these muscles untrained, they weaken further. But start today, and in as little as a few weeks, you could feel changes that ripple through every part of your life. You've just learned one of the most effective natural ways to reclaim firmness and confidence after 60. But there's another side to the conversation that many men overlook: how your daily self-stimulation habits can affect your health. And when it's time to talk to a doctor in the next video, Urologist explains how to masturbate safely after 60 and when to seek medical help. Men's health. We'll explore how to keep this private habit safe, how to avoid hidden risks, and how to recognize signs your body needs professional attention. Click here to keep building your knowledge and protecting your health. I'm Dr. Thomas. Thank you for joining me in taking this important step toward better male health. Remember, this video is for educational purposes only and should not replace medical advice. Always consult a qualified healthcare provider before making changes to your health routine. I'll see you in the next video.